Time now for another edition of Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Good morning, Dave. Glad to be with you and everybody.
Well, today we're going to talk about, we can go a couple of different ways with this. I know the medical community is using different terminology on this. Some call, and I guess you can have two different things as far as this goes, vaccine injury and COVID long-haul. They can be similar and they can be different, but again, vaccine injured or COVID long-haul. Chris Cuomo came out, I believe, a week or two ago and said that he believes that it might have been a combination of both for him. They're treating him with COVID long haul, and astonishingly, he seems to be on a daily regimen of ivermectin.
Right. Yeah. So that's the backdrop for sure. From the last 3 years, it's always okay. We're always learning. We're always seeing what else can we do to explain what we are feeling, what is happening to our overall health and wellness, our bodies, our balance, our quality of life per se. And an example this week, Dave, is, and this is just the reminder and why I'm talking about it today, is that we have a guest from California and staying with us this week and through the clinic, and has experienced some concerns for what we want to call COVID long haul or spike protein injury. This individual did get several of the injections and boosters, and there was a turn for her in her health, a definite change in the course of the last year and a half to 2 years after these events, after COVID, some of these COVID injections. So it's a reality that I see in the clinic, and so there are a lot of folks out there that their health has changed in the last 2 to 3 years. And it can kind of be this mystery where folks will sometimes say, well, maybe it's just aging. But in many cases, it can be a dramatic shift for folks, and it's quite obvious. And then we go on these long medical searches, imaging studies, seeing off to see the neurologist, the cardiologist, and this particular individual is had some varied blood pressure levels to the point of passing out and leading to fractures. So this has significantly impacted this individual's life, and just no quality and asking for answers. And so the group FLCCC that came out during COVID, it's a group of courageous physicians that advocated for early treatment, things like ivermectin, things like vitamin C, quercetin, vitamin D3, are proving to have borne out in reality. And so these were some of the protocols that, of course, I followed and recommended with some significant success. Well, now in the aftermath, we're kind of left to pick up the pieces, because a lot of folks, again, and medical practitioners are grasping for straws right now of how do we help folks that had some significant changes in trajectory in their health over the course of the last 2 to 3 years. And it comes down to looking at the spike protein, and the spike protein attaches to a site called the ACE2 receptors. We have ACE2 receptors everywhere, our brain, our lungs, our kidneys, our heart, our gastrointestinal tract. And when those get scrambled during that period of time, when we have exposure, and then we get this whatever you want to call it, COVID long haul, what have you, then these organ systems become imbalanced, and so you can have folks that have had changes in their digestive tract. Now that they're having chest pains, they're short of breath, they're dizzy all the time, they've got brain fog, and you name it, it can have a predilection for different parts of the body, and it can absolutely be from disabling to irritating, mildly irritating. And so, again, we look at what tools in the tool chest do we have, and Dr. Paul Merrick, he's an intensive care doctor, world-renowned, great guy out of the FLCCC that put out a book. It's called Cancer Care. It's a great book to look at all the repurposed drugs that are out there. So that same idea applies to anything and everything that we're trying to do to help people find balance. It's like, let's look at all the tools in the toolkit. How can we, and a lot of this is empiric, we're learning as we go. This is a new thing. This is empiric research. It's empiric clinical day-to-day operations in the clinic. We're trying things that we know are safe that might be able to get this spike protein popped off of that ACE2 receptor site, which is then contributing to symptomology or symptoms. And so we've noted that there's been some connection with microclotting. There's been some connection with we're seeing some increased rates of autoimmunity, which is where the body attacks itself. And so when we start to look at things that are out there, like nattokinase, for instance, Dr. Peter McCullough, cardiologist that has a lot to say on this. That's one with quite a bit of good data on it at popping that spike protein off of these receptors. The other thing is ivermectin. So there are a whole host of things, including even hyperbarics that and so we wonder why. Oh, why have hyperbarics been helpful for so many folks that have just over the course of the last three years taken a dip in their health? It is a multitude of reasons, and so in this case, this gal's coming out and we're working through all the different tools in the toolkit. So it still comes back always to, like we always talk about, Dave, is the functional walk and building the body's immune system back up and supporting digestion and getting rid of triggers that might be inflammatory dietary triggers, things like that. And then using these different tools to bring that individual along, because the body has this incredible capacity to heal. So I'm a believer, I'm an optimist that there are things that we can do, and we've been doing that across the country and across the world for folks that have been afflicted with some of these symptoms and are seeing some significant success with it. So that's the exciting part. I don't want folks to be feeling like, this is with me forever and I have no hope. There is hope. There are a lot of answers. There are a lot of things to do, and we can help. There are a bunch of practitioners out there, not as many as I'd like, but many of them affiliated, like myself, with the FLCCC that are out there pushing the envelope, trying to find answers, to think outside the box, to help folks not only with COVID long-haul or spike protein injury, but whatever that may be. It woke up a bunch of physicians, traditionally trained physicians, into saying, okay, what pharmaceuticals can we use that are off-label, but what other items that are nutraceuticals, vitamins, supplements, modalities, treatments like hyperbarics, red light therapy, what else can we use to not accept the fact that the body is fully injured and is not going to make any change for improvement? So again, hope, and there is always that, and we have a lot of we've got an amazing integrative team here that can assist from looking at things from a different point of view, that are going to walk with you to get towards a better quality of life.
One thing that I appreciate now is the honesty of some of these people. No matter what you think of Chris Cuomo here, pretty big step for him to come out and tell his story now. But also, in the last week, former CDC director Dr. Robert Redfield a huge proponent of the COVID-19 vaccine, came out and said, we have to be honest, some people got significant side effects from the vaccine. I have a number of people that are quite ill. They never have had COVID, but they are ill from the vaccine, and we just have to acknowledge that. And I would imagine that that's just part of the learning process. Is some people, the spike protein injury was one of the side effects.
Absolutely, and we have to reach out to folks in a way that it was such a divisive topic, and I don't want it to be. Right. I don't want it to be something that tears, because it tore a lot of
families apart. Tore a lot.
Yep.
It tore families apart. It tore communities apart, and it's silly because we should all want people to feel better.
Correct, and so that's what we're trying to do. It's like we're all on the journey together, and let's figure this out. That's where we were. Where are we now? And what can we do going forward to not repeat what we did before, learn from it, and elevate ourselves, elevate our other medical colleagues to, again, because this has been a learning curve for me as well over the course of the last 3 years of, as you know, I learned and knew one way. It was pharmaceuticals all the time, all the way. Mm-hmm. And so I don't have judgment out there. It's just everybody is kind of starting to figure some of this out, and it's there's no shame. It's just like, okay, that was a crazy period of time. It was a crazy 3 years, and what can we do to pick up the pieces and work together and learn from this? So, and that's the healthy conversation that's going on right now.
Absolutely. Real quick, because we're way past time, you had a young gal came to you from Illinois, a young girl that thought she was at the end of the line, and this story just keeps getting better.
Oh, my goodness, yes. Again, just quick recap. She's 15 years old and called us, and Mom and her are absolutely at wit's end because she has got joint pain. The doctors told her she might have lupus, which is an autoinflammatory disease. She was not sleeping at night. She was nauseated and vomiting, couldn't keep anything down. She was dizzy, again, exhausted, and she had this foot drop on when she would walk. And we talked to her, as I explained a couple weeks ago, let's hold out that gluten, and she did, and spent a week with us with the Hyperbarics, making some nutritional changes, making some suggestions, supplement regimen, the things that we do to help get folks back into balance, help their bodies get back into balance. Well, I followed back up with her this last week, and she's back in Chicago. The smile this young gal had on the televisit was absolutely just priceless. Mom and her were so grateful, and she's like, my pain is almost completely gone. We're continuing to do the regimen that we did at the clinic. We're still doing some hyperbaric treatments periodically out in Chicago area, and the nausea's gone. She is eating now. She wasn't able to get through a school day. Now she'd been able to get through full school days, sleeping at night. The foot drop's completely gone. Her head is feeling less scrambled. She's less anxious. I could go on and on and on. Her coloring looked better. So it was this young gal who was going to have to wait like 3 to 4 more months to get in to see the neurologist and the specialist. She just was kind of circling the drain, so to speak, and just had no hope and was feeling, oh my goodness, this is just, all right, what's next for me? And a dramatic reversal for her, and I just am happy to share her story because that's what it's all about.
That's awesome. All about getting people to feel better and live their life to the fullest. All right, Dr. Meyer, how do folks find you?
Yeah, please come out and say hi. We're at 3305 Berquist Avenue in Spirit Lake off Highway 71, and it's 712-339-6024. I do discovery calls on Wednesdays and Wednesday afternoons to discuss any questions you might have about how do you go about even getting started into the process of working through some of the health concerns you may have, the services we offer at the clinic. So that's a good way for me just to talk with you for about 10 minutes and say, hey, this is what it looks like if you're going to take this wellness walk with us. How do you get going about doing it? And then, of course, always welcome to come in here, and we'll give you a tour through the clinic if you want to see it. You're always welcome to come on in and say hi.
Very good. Dr. Meyer, always a pleasure to visit with you. Thanks for sharing stories with us today, and we'll visit again soon.
Beautiful. Be well. Take care, everybody.
Thank you, Dr. Meyer. Dr. Bradley Meyer with us again on another edition of Wellness Wednesday. And once again, you can find out more at OkobojiWellnessClinic.com.